Hello, I'm Barry Shore, Professor Emeritus at the University of New Hampshire and Head of Content Development here at SSGI. Scrum is a very effective way to manage projects in an agile environment where an adaptive approach is useful and not every step in the project cycle can be predicted in advance. It is a methodology that started with software development and has proven very effective in managing healthcare projects. Scrum begins with a vision. The product owner is the person who has overall responsibility for delivering a successful outcome. The dominant features and requirements of the product or service are recorded in a product backlog. For example, a product backlog for the design of a new hand hygiene system might include the following: assess current infection control practices, implement hand hygiene monitoring system, design training program, create patient room signage, establish baseline and ongoing infection rate analysis, design real-time infection control dashboard, and design compliance campaign. This product backlog includes so many features and requirements that it is neither feasible nor manageable to complete all of them at once. Accordingly, the project is decomposed into smaller segments called sprints. As a result, there may be many sprints in a project. To help facilitate the management process, they are configured to be the same duration. In most projects, sprints typically are between 2 to 4 weeks. In this example, all sprints have been set for 2 weeks. Once the product backlog has been built, the next step is sprint planning. It involves deciding which features and requirements from the product backlog will be addressed and then assigning an appropriate number of tasks to what is called the sprint backlog. Here is an example of a sprint backlog for the first sprint in the hygiene example. Review current practices in hand hygiene, review best practices in healthcare, compare current practice with best practices, identify gaps and areas for improvement. How are project participants organized? Those responsible for executing tasks are considered the development team. To the extent possible, the team is self-directed and it is responsible for delivering the expected results. The Scrum Master oversees the development team to ensure that the Scrum process is followed. One of the distinguishing features of Scrum is the daily Scrum meeting. 3 issues are addressed: what was done yesterday, what are the plans for today, and what problems might be encountered. Here is an important point. The meeting is purposefully short and lasts no more than 15 minutes. Everyone stands, and after the meeting, execution continues. At the conclusion of the sprint, the cycle begins anew: sprint planning, sprint backlog, and execution. Sprint reviews occur at the end of every sprint. Their function is to review what has been done and determine if the results meet expectations or if changes are needed. This is a hallmark of the adaptive nature of Scrum. While sprint reviews occur at the end of every sprint and focus on the features and requirements defined in the product backlog, the sprint retrospective is held at the end of several sprints and focuses on how the Scrum methodology has been followed. It addresses what has and has not worked and is therefore an opportunity for continuous learning and improvement. This has been a very brief introduction to Scrum, but it has hit the highlights. If you find this interesting and potentially helpful in your work, consider becoming professionally certified in Scrum. Having completed this introduction, you are already on your way. Full SSGI certification should take no more than 1 to 2 months. All materials are online, so you can complete the course at your own pace. Check out our full certification course at SixSigmaGlobalInstitute.com. Thanks for watching.